Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Fight the spread and take a stand against coronavirus. Wear a mask in public. Stay at least 6 feet apart from others. And get tested. Join us and fight the spread. Visit scdhec.gov/COVID-19.
Oh, happy Inauguration Day. I'm Trey Taylor, and you are watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's Wellness Wednesday, and In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. Well, Dr. Nancy Richburg joins us again to discuss vaccinations, COVID and flu. And if you need help controlling and preventing your diabetes, listen up, because she's got info about the Diabetes Prevention Program. Nancy, thank you so much for joining us again today.
Thank you so much for having me. I'm excited to be here again.
Absolutely. I see you've got your pearls on.
Yes, I have on my pearls and my pink and green because I'm happy that it's a happy day.
I'm not wearing pink and green. I'm wearing purple. Purple for Shirley Chisholm and then the pearls. All right. We'll talk to you in a little bit. We look forward to it.
I look forward to it.
Plus, last week we discussed the saying, you are what you eat. And today, Dr. Cheryl Scott brings us part 2 of the brain health conversation. Plus, she's going to update us on some new treatment for COVID. Thank you so much for joining us today. I appreciate you.
Thank you. Thank you so much for having me.
Absolutely. Both of these beautiful ladies coming up next on Coping with COVID. But first, your COVID community updates. 1 week after the Capitol building was sieged upon, the same location had history made today as the first woman of color became the vice president. Side note, her outfit was designed by an African-American South Carolinian, Sergio Hudson. The inauguration of Kamala Harris and President Joe Biden took place this afternoon. Among the performers include Lady Gaga, Jennifer Lopez, and Garth Brooks performed along with the first National Youth Poet Laureate, Amanda Gorman, who was also the youngest inaugural poet. Former Presidents Obama, Clinton, and Bush were in attendance. And of course, South Carolina was represented as Congressman Jim Clyburn wore his South Carolina State University hat. The remaining virtual events include the Parade Across America at 3:15 today and the Celebrating America concert at 8:30 tonight. All of those can be seen on all of your major television networks and across all social media platforms. Now, Congressman Clyburn is actually going to do a press junket about the inauguration today at 2:30. After the show is over, I'll be streaming that live right here on the Taylor Made production page. The IRS is urging people to beware of COVID-related scams. Those involving stimulus checks include text messages, emails, and letters asking for bank account information, unofficial sales of at-home COVID tests, pills, vaccines, and treatments, and they are also seeing scams seeking donations. Before doing anything, the IRS says call the fraud hotline. That number is 866-720-5721. And Lexington Medical Center has resumed their no visitor policy. Hospital officials say due to the surge in COVID cases, there will be no inpatient visitors for anyone, even those who are not hospitalized for COVID. There are some exceptions for those giving birth and folks that are having surgery. SCDHEC has your most up-to-date list of times, dates, and location for COVID testing in and around South Carolina. Visit scdhec.gov for more information. Also, for more information about getting a COVID test, you can visit gogettested.com. Now, there you can schedule your appointment and you can get your results in 24 hours. That's at gogettested.com. Check the screen throughout the show for information about organizing a COVID screening in your event or at your community. Also, in-person COVID screening is offered by Richland and Clarendon County paramedics. Call 911 for more information. The DHEC Care Line is still active, and not only can you get information about COVID, about transportation, you can also find out about the COVID vaccine locations and times. Plus, the website is listed on the screen. Now, speaking of COVID vaccinations, as you heard last week, veterans and those over the age of 60 can get vaccinated. Check the screen for information about COVID vaccines at Lexington Medical Center. Also, as I said, if you are a vet. Side note, I do want to let you know also, if you are a caregiver or live in the home of someone who is getting the COVID vaccine, whether that be a veteran or a or someone over the age of 60, then you can also get you can also get the vaccine. So make sure when you are getting vaccinated, you find out about that. The South Carolina Bar Association and SC Legal Services are offering free mortgage and rental information. You can check the screen for that. And the City of Columbia is offering a 6-month payment plan for water bills. Rashonda Pratt's YouTube page is still up and going. You can get help with virtual learning and working. And the deadline is next month for the South Carolina Education Association Scholarship Fund. Now, this is for graduating high school seniors. They're doing an annual scholarship. And again, please apply and see that information on the screen. Now, the new round of the PPP loans are up and running. And if you are a small business or a nonprofit and you want some more information, there's a new workshop that's going on tomorrow at 4:00. There's the information. Make sure to register if you want more information. In It Together SC and the South Carolina Diabetes Advisory Council present Wellness Wednesday every Wednesday here on Coping with COVID. If you want information to help you manage or prevent diabetes, visit the In It Together website and the In It Together Facebook page. We're actually streaming live on the In It Together Facebook page, so please don't forget to like and share. We're also streaming live on Taylor Made Productions. That's the home of Coping with COVID. I would love for you to do the same. Go over there and hit like and share. We're also streaming live on YouTube. Want to say hi to all of your YouTubers. Please hit the subscribe button. And we also have a presence on Twitter and also on IG. Don't forget to post and share this information so we can get the message to the masses, because everybody needs this information that we are sharing today. Dr. Cheryl Scott joins us. She is fresh from a COVID vaccine update meeting, and she's going to share some treatment for the virus. Plus, we're going to resume our conversation with her from last week about brain health. Thank you again so much for joining us today.
Thank you so much for having me.
Absolutely. So tell us about the meeting that you were at yesterday. It talked about monoclonal antibodies. Tell us, what is that exactly?
So you've heard of monoclonal antibodies. You may have heard of it referred to as Regeneron, or you may have heard of it as the special treatment that Giuliani and President Trump and others got. And it's important for people to know about this, because there are some vaccine delays, as we know already, but we are in the pipeline and everybody is in line and everybody should stay in line. But if you do get symptomatic and you go and get tested and find out that you're positive, you want to make sure that if you have an underlying health condition, that you make sure to get monoclonal antibodies. What's important about them is that it reduces the likelihood that you'll need to be hospitalized, as well as the likelihood that you'll progress to a serious COVID illness.
Okay.
So you've heard of these before, and it's not a new treatment, but at the same time, it's really important that people understand how important it is once you get infected.
So who should get this, Dr. Scott?
Well, it should be those who have test positive, and these are for early treatment. It's between 1 to 10 days within the start of your symptoms. So once you are further along in 10 days, it won't help you. It can be given to those, you have to be at least 12 years old, you have to be at least 88 pounds, and then you have to have an underlying conditions, person at high risk of getting very sick or needing to be admitted to the hospital, or who should be using them.
Right. So as you see, as the slide that you sent, so some of the people who should do this, as it says, 85 years of age, have the body mass index. And then, of course, as you said, those high risk conditions like heart disease, sickle cell, obesity, chronic respiratory disease, kidney disease, things like that, hypertension.
Exactly. All of those. And it's an infusion. You'll get it. You can get it at the emergency room if you have a positive test and you go in and say you have an underlying condition and you'd like to be considered for the monoclonal antibody. It's an infusion. It takes about an hour, and you'll sit there and do it. And then they watch you for another hour to make sure. It's an antibody. Your body makes antibodies, but until you have the vaccine, you're not making COVID antibodies. So this is synthetic antibody that will help take care of the infection until you do get the antibody, the vaccine.
Right. So is there a time when it should not be used? Are there people who should not get the antibody?
Yeah, people who are hospitalized. It won't help you then.
Okay.
And it actually can be detrimental. So those who are hospitalized and also those who are on oxygen, you shouldn't get it.
Okay. So can you break down a little bit more? I mean, because people are very skeptical, particularly people of color, about the whole COVID thing, about everything, but particularly about COVID, about the vaccine, about the treatments. So what can you say about this, the monoclonal infusion? Yeah. Mm-hmm.
Well, I can say that the mechanism you already know. So we have taken antibiotics since we were kids, okay?
Right.
So these are synthetic antibodies, okay? And you're going to be taking them until your body can make your immune system can kick in and make your own antibody. They have found that these monoclonal antibodies reduce serious illness by as much as 30%. So it's really important that people know about them. And it's also, the treatment itself is free. Eli Lilly has said they will hand.
Oh, wow.
Yes, it is free. I don't know about the hospitalization or about the ER visit, but the treatment itself is free. So it's really important. And there have been many practitioners in Columbia who've said that they're concerned that people aren't using it, people who it would really benefit.
Really? Yeah. So like you said, if you find out you have COVID and you have these underlying conditions, can you get this from your doctor? Should you request it, or is this something that your doctor can say?
No, you need to go to your doctor and have the doctor refer you, say, you need to go to the emergency room and get it. And when you get there, you just let them know. They will all of the same things. They'll ask you your age, and they'll ask you how long you've been sick. And if you are within 1 to 10 days of your illness, they will go ahead and say, yes, we can give you the monoclonal antibody.
Okay. Does it prohibit you if you have no insurance or anything like that?
No, it doesn't. And so they gave, after November of last year, they made an emergency use authorization because it was so beneficial.
Yeah.
You saw people in the media who had underlying conditions. You
Yeah.
saw them. And they did just fine. And so it was at that time, it wasn't available to everybody, but they did an EUA of it. And then people started using it. But then the vaccine came. And so everybody is really excited about the vaccine. And that's wonderful. But not everybody is getting the vaccine right now. So I'm wanting to remind, if you get infected, and hopefully you won't, because you're going to continue to social distance, you're going to continue to mask up.
Yeah.
But if you get infected, understand that this is out there to help you avoid serious illness.
So as you say, once you're diagnosed, if you have these underlying conditions, you can go to your doctor and request that they give it to you. So let me ask you this, because I'm wondering, those folks who don't have these underlying conditions, should they not get it? Will it not help them?
They have found, no, it won't help. They have found, the evidence shows that those it helps best are those who have underlying conditions, those who would progress to serious illness or need hospitalization. Those who get infected and are feeling very badly but have no underlying conditions and are probably of a younger age, they need to stay at home and treat themselves symptomatically and stay in the bed, lots of fluids, and they will get better. But monoclonal antibodies will not be of benefit to them.
All right. That's good information to know, that if you have contracted COVID and you have some underlying conditions, and we're going to throw up the list of all of those underlying conditions. But listen, if you've got an underlying condition, you've got it. So make sure you go to your doctor and ask your doctor if you can, get this infusion of antibodies, because it will help you withstand the virus. Now, will it shorten it or just help you become more comfortable? Dr.
It will shorten the course, and it will in some sense, not to confuse it with flu, but in some sense it's kind of like Tamiflu. It will shorten it, and it will lessen the severity of the illness, so that you won't need to go to the hospital. You won't need to, be put on a ventilator or anything. So you will not progress.
And how long does it usually take from the time you get the infusion till you start seeing some relief?
Probably 2 days.
Really? Wow.
48 hours, even shorter. Yeah.
Yeah, but you can
Yeah.
stay home with it. And
Right,
as you say,
exactly.
you
Yeah.
still need to isolate or quarantine and all of that, right?
You do.
Yeah.
Yeah. They will send you back home after the infusion. They will watch you for a couple of hours to make sure that there's no allergic reaction or anything.
Mhm.
But then you'll go home and you will start to feel better within 36.
So if you can go over again, what is actually in this antibody? What is actually in this infusion?
Okay. These are synthetic antibodies.
Okay.
Okay, that have been made, just like you are getting the vaccine, and then your immune system is going to make antibodies to the spike protein. I think you probably have talked about this before when you show the spike protein that's on the outside of the virus capsule. That is what you want to, you're getting a response to that with the antibodies. So the antibodies are there, and it's like you have a vaccine, except that you're having a synthetic antibody that's going to act for you on your behalf, since you can't do it, since you don't have a vaccine.
Yeah.
And it will create more and more antibodies and get rid of the infection for you.
All right. Mitchell Peace Joy Jen says this sounds like good news. We're talking to Dr. Cheryl Scott, and she's been telling us about the treatment that you've heard. You probably heard the president and some other folks got this infusion, this antibody infusion. And don't let that deter you, because he got,
Right.
that's really funny. I don't want to take anything he took, but look, he
No,
was in and out of the hospital in little or no time. So, but it's available. And as Dr. Scott said, it's available for free. The manufacturer, Eli Lilly, is footing the bill if you want to take it. And as she said, if you have COVID and you have some of those underlying conditions, this is excellent for you to take, because it will help decrease some of your suffering, some of the, the time that you are dealing with the virus. So that is good news. We're talking to Dr. Cheryl Scott on Coping with COVID Wellness Wednesday. Is brought to you by In It Together SC and the South Carolina Diabetes Advisory Council. We talked last week with dietitian Phyllis Allen about brain health, Dr. Scott, and we wanted to talk about it again. Now, you said there's something called blue zones.
The blue zones, yeah. So brain health is really important. It's important during COVID time. It's important just for healthy aging. And it's really during the time that we are here isolating, we want to make sure to keep our minds healthy.
Right.
It really doesn't help to sit there and watch TV all day. It is better for you to try to do some reading if you can spend time reading a book, not on the computer. But you need to, for your neurons, for the cells that are in your brain, you need to make sure to drink plenty of water. A lot of people are really concerned about Alzheimer's or dementia. And they have found that the most important thing for reducing the incidence of Alzheimer's is regular exercise, regular walking and drinking a lot of water, and making sure to eat healthily. That is what is going to prevent Alzheimer's. Many people think, oh, I need to be taking all of these supplements. There are some supplements that help, but exercise and water and making sure to have a healthy diet is really what's going to help more than anything.
Really? Now, a couple of questions I want to ask.
Mm-hmm.
When do you start this, and when is it ever too late to start?
It's never too late to start. In the old days, what I call the old days, we used to believe that the neurons that you were born with and the connections they made, that was it. That it never, you couldn't make anything new. Now we know that throughout your life, you can make new neurons and you can make new neuronal connections. So it's really important that you continue to stimulate your mind throughout your life. It's very important.
Yeah. Now, what about alkaline water? You mentioned that people should drink a lot of water. I'm a big water drinker anyway. And then, of course, last year I heard that alkaline water is best. You say what?
I agree. And I drink alkaline water also. And I cannot tell you how, once it hits your stomach, which is very acidic, I've often wondered how alkaline can this water be? But I feel better. I like the taste of it. I feel like I want more of it. And that for me really does make me comply.
Right. I want to say hi to everyone watching Coping with COVID. I'm Trey Taylor. Dr. Cheryl Scott has joined us. She's talking about brain health. She just told us about the antibody that folks can take if they have COVID. Dr. Scott, Danielle Lake wants to know if Alzheimer's is hereditary.
It is hereditary in some sense. I mean, you find it runs in families, yes. But there are things that you can do. Just because you have a family member that has Alzheimer's or other types of dementia, you can make sure that there are things that you can do to prevent it. You can continue to exercise and exercise throughout your life. You may feel like, well, I'm just starting at age 50 to exercise. Then that's the time you start, and you need to start regularly and keep up with it. And you need to eat healthily. You need to make sure to do some of the things that you may have heard of, the blue zones. I'm going to talk a little bit about some of the things that they learned from the blue zones. So in about 2004, some researchers and epidemiologists started thinking about how is it that people live to be in their upper 90s and in their hundreds. And they went around the world and they found 5 areas that they called blue zones. It's a non-scientific term. It just meant that it was on a map and they were circling it in blue.
Right.
But what was interesting about it was that they found that there were common aspects to these 5 communities in the world that had people who were 100 years, they were upper 90s, and some were even more than 100. And they were in Greece, in Italy, in Costa Rica, also in Southern California. You would think Southern California of all places. Yes, there is a community there in Southern California, a diverse community as well, racially diverse.
So what were some of the similarities? What did they find in those blue zones?
Well, they found that people moved a lot. They moved
had physical activity. Yeah.
So one of the places was in Okinawa in Japan, and they found that people worked. They worked till they were very old, but they walked to work. They walked home. They had more living outside. They lifted things. It was things more close to the earth.
Wow.
They also found that they weren't all vegetarians, but they ate a lot of plant-based food. They ate a lot of beans. They ate whole grains. They ate healthy foods that were not meat-based, basically. And also they took time to de-stress, okay? They didn't have the kind of intense life where it's one stressor to another stressor to another.
Right.
They took time to de-stress. And they also are part of communities, particularly religious communities.
Wow.
And they're committed to their families. And lastly, they have social circles that reinforce healthy behaviors. So for walking, they would go walking in a group. They would walk regularly in a group, and they make time to connect with each other. So even though this is COVID time, we can do the same thing. You can go outside masked up and walk with people. You can connect with people. You shouldn't stay isolated all the time. It leads to a lot of anxiety and concern. You don't want that to happen. But at the same time, you really want to stay connected to people. You can connect some even on Zoom. I mean, that's something that we've gotten used to now.
Yeah.
And you can connect that way as well. But I think that I just mentioned the blue zones to say that in terms of longevity, only 30% of longevity relates to inheritance.
Wow.
To genetics, only 30%. So the rest of it are the influences of our environment. And so
Right.
it's really, really important that we manage that as we age.
That's fascinating information. Mitchell Peace Joy Jen says, yes, walking does improve mental clarity. Daniel Lake says, thank you so much for your response, Dr. Scott. Very informative. It is because, I mean, you said some things that are really key. The folks in those blue zones, those areas, they all, you said they ate well, not necessarily vegetarian, but they ate well. A lot of fruits, a lot of vegetables, probably not a lot of sweets.
That's exactly right. And you can go online. There's a lot of information. This started in 2004. So they've been doing this for about 15 years. So they've got all kinds of books that will talk about a blue zone diet, for example.
Yeah. And then something else you said, not only did you say they are doing physical activity. And, you know, for me, Dr. Scott, that whether you can walk, and I think that's great, and, you know, walk around the house, walk up and down the stairs, but little things, and I say this all the time, like parking far away when you go to the grocery store and just walking, you know, simple things, take the stairs instead of the elevator or the escalator, you know, things like that. But there was something else you said, and then the spirituality was key, that they believed in something greater than themselves, you know. And, you know, those of us who are believers know, I mean, you know, one of the basic principles of spirituality, of Christianity, is cast your cares. You know, don't worry about it. Give it to Jesus. Don't try to be baby Jesus out here. You can't do nothing about it anyway. You know, that whole thing, because we are living in a day and time where stress is so huge, people worrying and being concerned. And I'm not saying there's not a lot going on. There is, but what can we do about it? And stressing is knowing nothing but it's not beneficial to us.
And it's you and your spirituality, yes, but it's also you and your community of people, and that are spiritual. So that's really important.
Yeah. And one more thing you said I want to key in on. I want you to expound a little bit. You said they live closer to the earth. What does that mean exactly?
So whole grains. I mean, I grew up where I grew up in California, in Oakland, and if you had white bread, that was considered good. And my mother, who was from Texas, was like, no, you eat this brown bread. So I remember going to school and everybody had nice Wonder Bread, all white. And here's my little brown bread and stuff. That's what I mean by closer to the earth. You know, the whole grains now we know is what, you know, we don't, if you can, when you can, eat brown rice. If you can, anything that's closer to the earth that hasn't been processed as much. So that really helps.
Yeah. And there's something I want to share that I shared on the show before, you know, when people say, but I can't get my kids to eat it. I mean, I have a custody of a 2 and a 4, almost 5-year-old who eat pumpernickel bread. Why? Because I eat pumpernickel bread and I've introduced it to them, you know. So while they do know what white bread is, they enjoy pumpernickel bread also. You know, but kids don't know what they don't like. You just introduce it to them and say,
that's
try
exactly
it.
Right.
You know?
Exactly right. And, you know, instead of going for cookies or cakes, make sure that kids are exposed to apples and oranges and have these available and in front of their face. So when they're wanting something that might be a little sweet, here's an orange.
Here's And same thing with those kids too. They love almonds because I'm a big almond. Now look, I'm not saying I don't like a good chocolate chip cookie or a Wise barbecue potato chip, but that's not the norm. That's our treat day, you know?
Yeah, exactly.
So, we're talking to Dr. Cheryl Scott, and we've been talking about the Blue Zones, brain health part 2. We talked to Phyllis last week with D. Heck. Before you go, we do have another question from Mitchell Peace Joy Jen about the COVID infusion that you mentioned, but I also want to talk about, is it better or worse if you are eating or drinking sweets? Is it worse if you eat them and okay if you drink them, or sweets? Bad is bad.
I'm not sure that there's much difference. Sweet is sweet, sugar is sugar. Okay. And if you have, you know, sugar that's in a smoothie, or it can be something like you think, oh, this is great. It's not much sugar in this smoothie. and there might be a lot. And then you think, well, this is better than, cake. I think sugar is sugar. Sucrose is sucrose.
Yeah. And what do you as far as vegetarians eating good? And because the fallacy is, and this is a fallacy. As a vegetarian, I know just because you don't eat meat doesn't mean you eat good.
Exactly. I'm a vegetarian also, and that is really true. When I'm really, that's why it's really important to plan your meals and plan what food is going to be around you. Because when I'm really hungry and I'd like some tofu, and if it's not there, then, I could go to something that's easy, like some vegetable chips. That's not as good, and they're fine,
right.
But it's not as good as having my tofu there.
Yeah. I'm not a tofu person, but it's okay. I don't like the texture, but I digress. I just never did like the texture. And you know what? It's probably better now than it was, when it first came out. Yeah.
I agree that I actually love it here in South Carolina. There are places where I can get, it may not be so good, but it's like breaded and fried tofu. I'm like, oh, this is heaven, I haven't analyzed it yet, but I absolutely love it.
Right. Yeah. All right, Dr. Scott, Mitchell Peace Joy Jen wants to ask about something about COVID. She had a question. She wants to know if people who had COVID and have recovered donate their plasma. Thanks, Mitch, for your question. Do you know?
Can they donate their plasma? Yeah, they can donate their plasma. I don't know if they're donating it here in South Carolina, but I do know that earlier, those who had it, they were asking people to donate their plasma.
Right. And we did talk about that a bit on the show too. But thank you, Mitchell, for your question. Dr. Scott, thank you so much for joining us. This was such a great conversation. I'd love to have you back on to talk a little bit more about how healthy aging, because whether we are doing it or we have a family member who's going through it. These are some things that we've got to be conscientious about. And, one of the challenges I know with not only aging, but navigating our family members is what can we do? They're sometimes withering away from us, on one hand, and then on the other hand, we want to preserve our lives. We want to live long, healthy lives. So I'd love to have you back on to talk a little bit more about that.
I'd love to talk about that. That'd be wonderful.
Dr. Cheryl Scott, thank you so much for joining us today on Coping with COVID. You were fascinating. I appreciate it.
Thank you so much, Trey. I appreciate it.
Absolutely. In it together, SCN, the Diabetes Advisory Council, present Wellness Wednesday every Wednesday here in Coping with COVID. Listen, if you want to get some information about how to help you manage or prevent diabetes, visit the In It Together website and Facebook page. Nancy Richburg is next. As a matter of fact, she'll discuss the diabetes prevention program. Plus, as a pharmacist, she'll break down the vaccines, the COVID and the flu vaccine. That's coming up next on Coping with COVID. I'm Trey Taylor.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
People will be able to look 100 years from now. They will know how we got over. This makes it even more important that we shine this light.
Part of it also wasn't the fact that we couldn't have the physical graduation, but I also couldn't celebrate with my family out of town.
For me, I feel like this is a new normal. This is not going away anytime soon, I don't think.
Anything that's happened before can happen again. And the same thing is at play with this virus.
We are no longer in a building, and we've talked about church being, with us, in us.
Have you traveled abroad late in the past 6 months? We were trying to trace it back as early as November.
In it together, the South Carolina Diabetes Advisory Council present Wellness Wednesday every Wednesday here on Coping with COVID. If you want help of trying to manage or prevent diabetes, visit the In It Together website and Facebook page. I'm Trey Taylor. Thank you so much for joining us. Please continue to post and share this information out so we can get this message to the masses. We're joined now by Dr. Nancy Richburg with Salubrious Pharmacy. She joins us again with her pearls and her green and her pink lipstick.
Yes.
Did you go to HBCU?
I did not go to HBCU, but that is my soror, Madam Vice President.
She is.
Kamala Harris. So I very proudly wear my pearls and my pink and green.
Yeah, like I said, I'm wearing my pearls too. And I think the purple is in tribute to a Shirley Chisholm.
Yeah.
And then I went to HBCU. I went to Hampton. So, you know, it's all good, girl. Black women are doing the thing in this little last 12 months. I mean, it's just so, that's a whole different conversation, but I just love being a woman, and I love being a Black woman. And I'm just so excited and happy for everything that's going on in our nation right now. So listen, and like I said, we'll have to talk about that another time, because you and Cheryl also are sisters that are really doing some amazing things in this space in the medical profession. And look, that just was not my look, sometimes y'all will talk and my head is about to explode, but I'm so glad we've got sisters like you and Cheryl, you know, that are doing something. So I know that you have an NDP, a National Diabetes Prevention Program, that you want to talk about, and I want to cover that. But as a pharmacist, Nancy, you know the chemistry. You can really break down these vaccines for us.
Well, the vaccines are so vast. There's different forms of them. And so what's important about the COVID vaccine and how it differs from the other that we have seen over the years, when we talk about the flu vaccine or getting your tetanus shot, or you give your kids the measles, mumps, and rubella, is that this is using a different technology that to many will be perceived as new, cutting edge. It is new in the sense of decades, but they've been working with this technology since the 70s. So it's not something that just came out of the sky this year, which I've been hearing people say.
Yeah.
So it's been investigated and used in different areas, even cancer or any disease treatments. And that's what makes this completely different in the way that your body is going to be able to create antibodies to recognize if you come in contact with this particular virus. So it works a little bit differently, but it's great.
Right. So let's talk about the COVID vaccine first. Dr. Bell was with us last week, and he actually took the vaccine, and he was talking a little bit about how the vaccine works. Can you tell us how the vaccine actually works?
Well, I will give a very high level view because it's a lot of biochemistry.
Don't do it, girl. Don't do it. Just break it down.
I don't want to go in there for you. So
no,
on a very elementary level here, it's your body recognizes foreign objects that come into it, and it says either, hey, you don't belong here and I want you gone, or it doesn't recognize them right away and there's a delay. And that's what was being observed with the COVID, with the coronavirus, is that it gets into our bodies and we don't necessarily recognize it. And by the time our body starts to defend against it, it's a little bit too late. Or our bodies have an overreaction. And that's when you start to have some health complications. Mm-hmm. So with this particular vaccine, when they inject that vaccine into your body, it sends a kind of, I want to say, I'm going to use this term, a message. It kind of talks to your body and says, hey, I've got this strip of information that I want to tell you what to do. And your body takes it, it replicates it and says, hey, this isn't supposed to be here. I don't want this particular entity coming into my body. So then your body creates antibodies. And now it's sitting there waiting. Like, I dare you to come into this body. We're ready. We're ready to go. And that's a little different because it's not the actual virus. It's not live. It has not been killed or changed. It's something that they were able to engineer. So similar to what she was just speaking about the monoclonal antibodies, that they're synthetic or that they are antibodies that we're putting into into your body. It's kind of similar along those lines.
Okay.
I do want to dispel some things I've heard people say, is that you're going to inject something into me that's going to change my DNA.
Wow.
Because you hear messenger RNA and you think it's going to change my DNA. And that's not the case. It does not change your DNA. It comes in, the body recognizes that, hey, this isn't supposed to be here. It actually destroys that. So it gives it to you in a non-lethal way, in a non-health detrimental way, so that your body can start to create those antibodies. So you cannot get COVID from the vaccine.
Right.
But the vaccine will help you to be able to defend against that. So it is a 2-part series vaccine. So regardless of which one you get, you're going to need 2 inoculations in order to start to defend against it fully. You get some activity after the first one, and you get more. And I can relate that to people if anyone has come of age. If you're at 50 and you need to get the shingles vaccine, right now we're doing Shingrix. So for those of us who didn't get the chickenpox vaccine, we might get shingles.
Right.
And that's a 2-part series vaccine. So this isn't uncommon to have to take 2 injections. Some people are worried about having to do that. This is something that we're moving forward with because it helps to decrease your side effects.
Well, I'm glad you mentioned the shingles vaccine. We didn't talk about this in our pre-interview conversation, but I do want to talk a little bit about it because it's so interesting. I'm starting to see more commercials now about go get your shingles vaccine. But let's stop there for a minute. Let's go back to COVID. So when you take the first shot, do you get any immunity? Did you get anything? I mean, you obviously you said you need both, but what do you get with the first?
You do get some coverage with the first vaccine, with the first dose. And so I received my first dose also. It was pretty exciting. I feel fine. I go get my second dose next week. I will share that I wasn't nervous, but I just don't like needles. As a pharmacist who gives injections or looking at needles, I always flinch, and they usually think they're killing me, and I barely feel it.
Right. You like to give and not receive.
Yeah, absolutely. I prefer to give that injection. So when they go in, though, I use a breathing technique to try to make it a little bit better.
Yeah.
I inhale and then I exhale as they're entering, and it doesn't really hurt as much. The important thing is to keep that arm relaxed. A lot of people flex their arms. They want to lean on the table, or worse, they wear a long sleeve shirt and then they have to roll it all the way up, and now they're flexing that muscle. Your muscle should be relaxed.
Right.
And when it's relaxed and that technique, you go right on in and you inject the medication and you come out. I did feel some pain and burning at the time, and he informed me, you're going to start to feel a burn, and I did. And as he came out, I was like, oh, you're done. Just like everyone else. I go, oh, that wasn't that bad.
Right.
And then they have you sit. With this one, where we really like for you to sit in general after an immunization, just so we can observe you and make sure you're not having a reaction. With this particular vaccine, they're making sure you're going to sit for about 10 to 15 minutes before you leave. Mm-hmm. And that's because it is new. We want to make sure if you're having a reaction, you're still in an area where you can be helped.
Yeah.
Where you're not jumping into your car and then having a reaction at the red light. So as you sit there, you start to feel the soreness at the injection site a little bit more, but it's important to also move your arm a little bit.
Yeah.
And then if you're feeling okay, you can get up and go. And the pain on the arm stayed for about 2 days. I did take Tylenol or acetaminophen. They're not advertising with me, but I did take Tylenol. That was my choice, but usually it's recommended Tylenol or ibuprofen and Advil or Motrin, whichever one you're able to take, barring any allergy or other medical condition. You can take 2 of those or 1 of those that help. Whatever you take for pain is something that you can take to help relieve that pain at the injection site. And about 2 days later, I had a minor headache, and I took 2 more Tylenol, and I haven't had any side effects after that. So I was pretty good with my side effect profile. The estimate is that first dose gets you about 50 to 56% in your effectivity.
Okay.
And then you would need to get that second dose. And the timing of the second dose depends on the vaccine that you received for the first dose. And that's what's important. So with the Pfizer vaccine, which everyone is very familiar with, that was the first one that came out. That's at about 21 days. And you have some leeway. I don't want anybody to be like, I have to have it in 21 days. You do have some time.
Okay.
They don't want to get it any sooner, but you can go a little bit later if you need to and get that second dose. And with the Moderna, our second one that's on the market that we see, it's 30 days. Mm-hmm. And so when you get I like this system and this method, actually. A lot of people are looking at it, but you register for your appointment and you go in for your appointment. When you're complete, you get a request for your second appointment, or you're actually setting that second date right then. And that's very helpful to make sure there will be enough vaccine for that second dose. The state then allocates it and says, okay, I have someone coming to get that dose. We don't want people to not get their second dose if they're able to.
Right, right. So after the first, you say you've got about 50-60% coverage, but you obviously still need to wear your mask, social distance. That second vaccine, you're totally covered. So Nancy, does this mean you won't get it, or does it prevent or protect?
Let's look at that term. You're totally covered. The stats that they have, the statistics are based off of the studies they did before, which were with much smaller groups and numbers of people who have now received the vaccine just in the last month, right? So what it gives you is about 95%, 96% effectivity. Some of the vaccines are showing even better. And that can fluctuate and vary as we start giving it out to more people. So you'll see different news, different reports coming out, different countries even, that will say it's not quite as effective. We're not quite sure, but these things take time. Most statistics that come out for vaccines are usually a year in lag, a year behind, because we want to make sure how is it working. But we had to get these numbers out very quickly for this particular situation during a pandemic. So it puts you at about 95%. Now, most immunizations, all of them, are not 100% go out there and just roll around in some COVID. Take your mask off and start laughing and going back to our old habits. You're just protected. So you still want to use the precautions of washing your hands, as long as we still have regulations, wearing your face mask and social distancing, and keeping those protections there. And if you come around someone who is infected, still making sure that person is quarantining. That doesn't mean that you can just walk in, but it does offer you additional protection.
Okay.
Yeah.
Now, what about folks who do have diabetes as one underlying condition? Are there additional concerns for them with the vaccine?
Not with the diabetes. There's some concerns if you have severe breathing disorders.
Okay.
If you have an allergic reaction to the vaccine. So you've heard about some of the allergic reactions, and that can happen with anything. If you're allergic to any of the components of the vaccine. Of course, no one knows if you're allergic to mRNA vaccines because this is the first one that's coming out. However, there are some components within this vaccine that you may be allergic to. And that number one is, and you'll see PEG. And that stands for propylethylene glycol. Mm-hmm. So when you hear that and you're not in science, you go, propyl who?
Right.
Like, what are you talking about? What is that? P what?
Right.
And the one way to think about it is if you've ever had to take a colonoscopy and they give you a preparation, one of those preparations uses that ingredient. So if you had an allergic reaction to that big jug that you had to drink, this is mostly for our people who are 50 and over that have had colonoscopies, then that would be something that you would need to make sure your doctor or whoever's about to immunize you is aware, and they probably will tell you not to get the vaccine.
Right. Okay. All right.
And that's also the trade name over the counter would be Miralax. If you're allergic to Miralax, not that it upset your stomach, not that it worked a little too well, but that you actually had an allergic reaction to it, that's something to say. But if you're unsure, always give the additional information before they inject your arm.
Right. We're talking to pharmacist Dr. Nancy Richburg with Salubris and Pharmacy. And she's been talking a little bit about the COVID vaccine, breaking it down for us. I want to go to talk a little bit about shingles. And I know you want to give us information about the diabetes prevention program that you've got coming on, Dr. Richburg. But before that, tell us a little bit about the flu vaccine. Why is it important now, maybe more than ever, that folks get their flu vaccine?
Is still important. Some people are. Thank you for asking about that. Some people think they don't need to get their flu vaccine because they're not hearing about it in the news as much.
Right.
Yes, our numbers are much lower than they were, probably because everyone is sheltering in place and using face masks and actually washing their hands.
Yeah.
But it's still important because it's still happening. We still have numbers. And in the low country, I do believe our numbers are starting to increase slightly. So it's still your flu vaccine. Why? Because if you do get the flu, what sometimes can happen with the flu is now you're sick, now you're down, now you're laying down, and that leaves you susceptible to a pneumonia or to a COVID infection. And so you wind up getting that as a secondary infection. So you want to make sure you're protecting yourself.
Okay. All right. And again, just to dispel another old myth, the flu vaccine doesn't have the flu in it. It won't give you the flu.
No, the current flu vaccines are not live vaccines.
Right.
The ones that we inject, they're not live vaccines. They're what we call live attenuated. So the virus is not alive and cannot cause the flu. You can have flu-like symptoms from a vaccine because your body's creating antibodies for that vaccine. But if you were to get sick right after getting the flu vaccine, you more than likely were already introduced to the flu.
Let's talk a little bit before we get to your National Diabetes Prevention Program about the shingles vaccine, because it's so interesting. I just had not heard about shingles a lot. I mean, I've heard people had it, but then just this week, I've been seeing a lot of shingles commercials. Now, here's the thing. I don't watch a lot of live TV. People always say I watch pre-recorded TV, so I'm rushing through the commercials. So maybe it's me. Maybe I just haven't been seeing commercials. But is there a specific concern about shingles right now?
Well, shingles, as you know, comes back after you've come in contact typically with the chickenpox.
Right.
And we came out with a chickenpox vaccine. Right. So we're getting to that last little tail group of us that did not get the chickenpox vaccine.
And I didn't get chickenpox, measles, or mumps, nor the vaccines. So I could have all kind of stuff.
We don't know what you might wind up with. But for, as people round around, and it's usually right around that turn of the year, because now you have another group of 50-year-olds. And now these are people that we're targeting for the Shingrix vaccine or for the shingles vaccine. And so that's where you're going to start seeing that. Now, something that's important to say also is that with any other vaccine that you may need, the CDC is currently recommending at least a 14-day time spread between getting the COVID vaccine.
Okay.
So if you've registered for your COVID vaccine, or if you're thinking about getting it and you think you might get it within that 2 weeks, that's not the time to go and get your shingles vaccine.
I'm glad you mentioned that.
Time that out. So it's recommended to spread those out, and it's possible to do, since there are 2 series, to spread that out. But that's with any vaccine, because we just don't know how this vaccine will interact with any other vaccine. So that's what the recommendation is.
Okay, so if you're 50, tell me why you should get your your shingles vaccine first.
Well, you're at if you're turning 50 and you're not quite up to get the COVID vaccine, you're not in line for that just yet. We're still, some states are moving to 65. We're still at 70 to 65 range. So you would want to get that because shingles is very painful. You don't get to decide where it's going to come on your body. It could come on your back, your hand, your leg, or your face. And the pain lingers and it stays there. So if there's the Shingrix can be also a little painful also at the beginning, but everyone that's ever had shingles has told me that it's not as painful as getting the actual condition. And they were very excited to get that. So making sure you're up to date on all of your vaccines is very important at this time. And COVID is a pneumonia viral infection. So if you're due for your pneumonia vaccines, it's important to go ahead and get those as well.
Okay. All right. Great. And you say if you've got to get your flu vaccine, your shingles vaccine, and your COVID vaccine, how should you space those out?
Well, since we're having that delay in getting the COVID vaccine, if you're not already scheduled, and right now all of the doses in South Carolina already have appointments for them currently. So I would say go ahead and get your flu vaccine. If you haven't got one this season yet, it's not too late. It's still there because we're not doing as much traveling. You just don't see the numbers coming out. But as we start to move a little bit and people are starting to get a little antsy, you would want to make sure you had that protection.
All right. All right.
And they're still available. We still have them at Salubrious Pharmacy as well.
Okay. Okay, great. Now, you have got a diabetes prevention program that you are starting up in February. Tell us about that.
That's going to be our second cohort specifically for South Carolinian residents. We're doing that with In It Together. We're excited to be starting another one. This is a great year-long process that we meet as a group online. We use Zoom as our platform because we're not meeting in person, but it still is very fun. We have an exciting time, and we discuss topics for anyone who is at risk or has been diagnosed with pre-diabetes.
Okay.
That is something we can turn it around. We can change that, and that is something that is really heavy on South Carolina right now, and we just want to get us healthy. And that's why I love In It Together. We really are in it together. And in this platform, we aren't restricted to the upstate. You're coming in. So I'm based out of the Powdersville in the Greenville, Anderson County area, but we can even have people on down in Charleston or in Mount Pleasant. They can come online and meet with us, and we have a great time. We do different competitions, but we also learn a lot about the importance of exercising, which we just heard also helps with your brain development.
Yeah.
Proper eating, and just tools to put into your bank to help you give yourself that reinforcement. So if you've ever been sitting around, and right now with COVID, you hear about diabetics are at a higher risk, people who are obese are at a higher risk, and we don't want to have that plaguing. Those diabetes tends to come along with their friends hypertension and sometimes asthma. So those three conditions can really affect each other as they interact with each other, but also as you try to prevent them, it prevents all three. So it's something that's really great.
So this is a program that is doable. It's easy, as you say. You're doing it as a group, so people are there to support each other.
Yes, it's a group of about 15 people, no more than 15, because we want to keep it intimate. Yeah. And then you get a trained lifestyle coach, such as myself, and one of my team members. You get a trained coach who comes on and kind of facilitates and walks you through different exercises as you start to make changes in your lifestyle. It's hard to make those changes, and we've all made New Year's resolutions. Yeah. And by February, they're gone.
That's right, because we got to eat some candy for Valentine's Day.
Right, they're out the window. So that's why we wanted to start in February. Yeah. Because right about now is when that, yay, I'm gonna lose all this weight. Yeah. This is hard, and so you need some support. And it's not a weight loss program, but through the process, people have lost 5 to 7% of their body weight within the first 6 months. Our current cohort has lost on average 3% already, only at week 9. Wow. And we've had someone that has lost as much as 11% because they were like, I want to change my life. I'm going to do this. Wow. And it's not restrictive. And, it's introducing different foods. It doesn't mean you have to sit there and chew on lettuce all day. There's so many different food options.
There are. Yeah. I always tell people, like, when you look at a holiday table, like a Thanksgiving table, you have so many more vegetables and sides than you have the meat. You know what I mean? So when you think about not eating meat, in my case, or something else, there are so many things that you can eat, So listen, Nancy, if people want more information about the program, you're registering now. What are the qualifications? You have to either have diabetes or pre-diabetes, or
right, or be at risk. So if you're over 45, if your doctor has told you have pre-diabetes, or if you have an A1C that is anywhere from 5.6 to 6.1, that puts you right in that mark. If you have a family history of diabetes, that puts you at risk. If you have hypertension as well. If you are not exercising, not moving, and we've had people go from couch potato to doing 5,000 steps a day. Wow. If you had gestational diabetes, that also puts you at a higher risk. If you're African American, that puts you at a higher risk. Wow. Also, Native American and Latino, that puts you at risk. And we are going to be offering our classes also in Spanish. So I'm very excited about that.
That's great. Yeah.
So they'll be in 2 languages. So if you're at risk for that, but you can also take a risk assessment score at the CDC's website, or you can go to my website, www.salubriousrx, and we put the link.
We've got it right there
as well. Okay, great. And if you go on there, and we have the link that takes you straight to the risk assessment test, and then you can tell us your score and we can talk about it. Some people will qualify for this particular program, but we also have others that can help them to make sure that they take back charge of their life and in their health. And that's something you can control. And this is a condition that we can treat that's been plaguing our community for quite some time. And it's time to take control of it.
And I say all the time, you do it for yourself. You do it because you are worth it. You love you, and you want to have a better quality of life. You want to be there for your family and friends, whether it's your grandkids or your nieces or your nephews or your honey or whoever. You want the best quality of life. So this is something you can do. Nancy's information is up on the screen. Please contact her. Please contact her and sign up for this diabetes prevention program. Before you go, Nancy, Lauren had a question about the Lupron injection. Are they the same ingredients as the COVID ingredients?
No.
Okay.
They're not the same ingredients. So when you think about what you might be allergic to, it would be the polyethylene glycol, and that's not really in a lot of different vaccines. That would be something that if you did come in contact with it, most people would know that they were allergic to it. And they'd be aware of that. But if you have an allergic reaction to Lupron, they will ask you. Latex is not in this particular vaccine. So if you're allergic to latex, that is not there. That's not something to be concerned about with that.
All right, Lauren, thank you so much for asking that question. Nancy, thank you so much for joining us again today on Coping with COVID. Like I said, please send us that information so that we can continue to post and share the information out about the diabetes prevention program. I appreciate you, beautiful.
Thank you. I appreciate it. Have a great day.
Thank you. You too. In it together in the South Carolina Diabetes Advisory Council present Wellness Wednesday every Wednesday here on Coping with COVID. Hey, listen, if you want information to help you manage or prevent diabetes, visit the In It Together website and Facebook page. And don't forget to check out Nancy Richburg's upcoming class, a virtual class to help you prevent or stop your prediabetes. If you have a story that could help someone cope with COVID, please go to the Taylor Made Production page on Facebook and inbox me. We would love to share your story or initiative. If you have a product or service that could help someone cope with COVID, please email copingwithtreytaylor@gmail.com. And we would love for you to be a proud sponsor, just like In It Together, the South Carolina Diabetes Advisory Council, SCDHEC, and the City of Columbia Office of Business Opportunities. It's coming up tomorrow. What happens now that the inauguration is over, and what are some of the next steps? We're going to talk with CNN analyst, attorney Bakari Sellis, CBS political analyst Antoine Seawright, and Democratic pundit Josh Sawyer. We're going to talk about the inauguration and next steps for the administration. Friday, it's another COVID survivor show. We're going to talk to 3 couples who all 6 of them, their whole families were affected with COVID. Patrick and Sharani Patterson, Irmo Mayor Barry Walker and his wife Susan, and Marvel Mendenhall and her fiance Richard Bell. We'll talk about COVID survivors. That's coming up Friday on Coping with COVID. I'm Trey Taylor. Thank you again so much for joining us. As usual, I leave you with a reading from Jesus Calling. Today is January 20th. And Jesus says today, approach this day with awareness about who I am. As you make plans for the day, remember that Jesus orchestrates the events of your life. On days when things go smoothly, according to your plans, you may be unaware of God's sovereignty, his presence. On days when your plans are thwarted, be on the lookout for me, Jesus says. I may be doing something important in your life, something quite different from what you expected. It's essential at such times to stay in communication with me, accepting my way as better than yours. Don't try to figure out what's happening. Simply trust me, Jesus says, and thank me in advance for the good that will come out of it all. I know the plans I have for you, and they are good. That's a good reading today from Jesus Calling. I'm Trey Taylor. Thank you again so much for joining us. As always, I wish you peace, abundant blessings, and encourage you and remind you to please wear your mask over your nose and under your chin. See you tomorrow.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.